I am pleased to report that more than 8,500 Albertans have now recovered from COVID-19. However, we conducted over 8,200 new tests yesterday and identified 114 additional cases. Currently, 106 people are in hospital, 21 of whom are in intensive care. Sadly, 2 more Albertans have died. This leaves 2 more families grieving their loved ones, and my sympathies go out to them. My sympathies go out as well to those who are in hospital or ICU, and to the families who are watching their loved ones battle this illness. This is yet another reminder of how serious this virus can be. Our current acute care utilization is approaching the highest number of admissions on any single day that we have had, which was a peak of 113 overall hospital admissions on April 30th, and specific to ICU, 23 admissions on May 1st. This needs to be a wake-up call. I am very concerned by these numbers. Recently, our active cases have risen sharply. On July 9th, we had 590 active cases. Today, we have nearly 1,300. 2 weeks ago, we had 7 Albertans in the ICU. Now we have triple that number. This is also a reminder that severe outcomes are not limited to the elderly. 24 of those currently in hospital are under the age of 60, including 7 who are between the ages of 20 and 39. In addition, there is no zone spared from the increase. Even rural areas, such as central Alberta, which has not seen high case numbers so far, now has 33 cases in hospital, 7 of whom are in the ICU. We have seen a rise in cases across the province, and as such, precautions need to be taken in all parts of Alberta. I think we've seen some challenges in places where masking has been mandatory, and we're again wanting to learn from those situations. We also know that while, as I mentioned, there are cases across the province, there are certain locations that do have higher risk than others. And so before we would implement a province-wide measure, I think we'd need to consider, again, whether that same measure is required across the province. Also, I think a concern that's been expressed to me, and one that I share, is that we could inadvertently, if we are focusing too much on the question of masking, we could distract from all of the other measures that are critically important. And there is some evidence to suggest that, for example, consistent physical distancing, when that's achieved, is more effective than masking. And so we just need to make sure that we're, again, assessing the evidence, understanding that risk of harm, looking at the provincial picture versus the local picture, and if there are local settings where it makes sense based on epidemiology, then the local jurisdictions do have the tools to be able to move forward with this as an addition to their particular protocols. So again, those are the things that we need to take into account as we're looking at the questions around masking. I've heard reports of increased demand in Calgary, particularly for those who don't have symptoms but are wanting to be tested. I don't currently have the metrics from Alberta Health Services on the volume of requests per day or what their wait times are. What we are doing is making sure that whatever the volume of requests is, that we're reserving spots for those who have symptoms, those who are in long-term care, or continuing care settings, or those who are close contacts of a confirmed case or in an outbreak setting, because it's those individuals where we would have a higher concern of potential positivity. They have a higher, what we call pre-test probability, or a higher likelihood that they could have COVID. And so those groups of individuals are the ones who we need to make sure we move through the system as quickly as possible. Unfortunately, that means that sometimes those who have no symptoms and no known exposure, it can take a little longer for them to reserve an appointment. And we are working very closely with Alberta Health Services on expanding access and making sure that we do have the capacity to meet demand. And that is a work that's in progress right now.